Oh, Jason, you outside again with that cool background?
It's like a 3-season porch or a sunroom or whatever, but
Are those green leaves real? Because they haven't changed their appearance.
no,
How long?
they're the same ones since the very first weeks of COVID. My daughter and my wife
Oh,
sort of had this little Zoom area for us, and it stayed.
look, I just like put my obnoxious diplomas there because I picked over them in the closet. I'm like, I might as well put them up and make this look like a smarty pants.
Yeah, I haven't had an office for the last 3 years, so now that I do, I have to put mine up again.
Oh,
They
yeah.
collecting dust.
There you go. Hey, Elaine.
Hi, Laurel. How are you?
Whew, not bored.
That's good. I agree with you.
Oh, man. Robust.
Neither am I.
I may need some coping skills, Jason, from your old line of work.
Oh, yeah, me too. It's been fun to plug back into some of that old toolbox that I haven't used for a few years.
Yeah, the diagnostics. I took a deep dive into DSM-5 yesterday going, okay, what am I missing? Let me.
Yeah.
It's a wild world in psychiatry
It sure is, isn't it?
and therapy. Well, Riverside's awesome. They're good people. It's just.
But you're all helping. You're all helping us.
We're
You're all helping us.
We're all helpers. Look at the helpers. Who's helping the helpers?
You are.
Well, we're being recorded. I'll be.
All right. We know what's going on in the world.
Elaine, you keep saying you have a new job. What are you doing?
I'm teaching clinical instructor for community health
Where?
1 day a week.
Where?
Middlesex community.
Good for you.
Yeah.
Sure, you're awesome.
We'll see. Tomorrow's the first clinical day. We'll see what happens, as long as everybody shows up.
Where are you bringing them?
They have 7 sites.
Oh, so are you like, this? You're bringing me to my Wayback Machine. I used to do that. Like,
Yeah.
I would bring kids to the schools, and then I would like drive around, and then I would have post-clinical conference, usually at a school, until they called me and said, Mrs. Corville, Evan has a fever of 102. I'm like, well, I guess the conference is in my dining room.
Yeah, it's nice connecting with a lot of other public health people I've been with for the last like 20 years. So it's really good.
Awesome. Middlesex.
Yeah, it's good to get a different perspective, especially after COVID with these young students, and they're part-timers. So a lot of them are second careers or advancing.
A lot of them are second careers, thank God. And I think, yeah, that's cool.
We'll see. We'll see how it works out.
Goodness, look at all these people who are joining us. This is lovely.
I know, I love it.
Big surprise. Where's Anthony? Oh, he's got 2 minutes to go. Anthony usually comes in flying. Like, what? I'm here.
Wait, is he? Are we putting a bet on tonight, Laurel? Cindy, did you see the message from Melissa Lowry? She on mute?
Yep.
Hmm.
I'm able to do maybe 3 clinics.
Times are
different this year.
Yeah, I'm going to do at least, I volunteered for 3 or 4, and she kept on saying to me, that's too many. And my hours are just the 1 day. So I'm, trying to do as many as I can. But she only put me in for 1 so far. So I don't know why she'll like me, I guess.
If we're utilizing the team that we've had before.
Yeah. A lot of the same people, a lot of the volunteers from last year. It's amazing. I'm so excited.
They really like it. We still haven't given them the party that we promised.
Oh, wow.
Never ends because we're, though officially it's over, right? So
yeah, no, it's not officially over. I just finished reading the stats today, so.
I know. I was exposed the other day, so I guess it's good that we're filming.
I don't know. Is Cindy? Let's see if she can unmute herself. I want to see if she saw the email from Melissa.
Well, Melissa's also here.
Is Melissa there? Oh, there she is.
There's Tom Mullen. We'll let Tom speak first, right? All right, it is at one party. Hello, Mr. Mullen.
Hello.
Good to see you. We miss you.
Oh, thank you for having me.
Our pleasure. Thank you for joining and giving us some guidance.
Like that. Just had a conversation about that not too long ago with someone.
Well, you're going to meet all sorts of faces. I don't know that you know Candace Linehan, our chair,
No, hi.
and Candace is fabulous.
Anthony,
And Anthony's coming, and then Elaine. So
All right.
we're the three people who care about this discussion, but everybody else is in our growing department. So that's pretty cool.
Great. Thank you.
Can everybody hear me?
Yep.
oh yes,
Oh,
right
it's
on
working.
time, Anthony, right on time.
Oh man, we lost our bet. Well done.
We're gonna have to get you an award. We're gonna have to get him a certificate. Cindy's gonna have to make you up a certificate 2 months in a row. That's really good.
Oh, I know. At least the audio is working today.
All right, everyone, what do we say we call this meeting to order? It's 6:01 on September 21st, 2022. This is the Board of Health meeting for September. Present myself, Candace Linehan, Elaine Silva, Laurel Gorville, lots of guests tonight. Thank you, everybody. I understand that maybe we might need to flex the agenda a little bit. Some folks maybe need to leave a little bit sooner. Is that right, Melissa? Did I understand you need to?
Yeah, could we
Melissa,
actually?
you're on mute.
Oh.
I think you might just want to. Anthony, go ahead.
Yeah, I was gonna say, if possibly we could have quick introductions for our new folks and then go to Melissa. We can do camp right after, and
Well,
then
hold
Melissa.
on.
Melissa.
We have a professional who booked in on the line. Tom Mullen is with us.
Yes, I was not expecting to go before Tom. I was just
Oh, okay.
hoping to go before Jade Gourmet.
So how about we start with Mr. Mullen, and then maybe we can put the minutes toward the end. And I suppose if we had to, we could even talk about that at our next meeting. Mr. Mullen, are you prepared to go ahead?
Sure, thank you. It's always a pleasure to speak to the Board of Health. As I understand it, you want some general guidance about executive sessions. So let me explain the open meeting law as I understand it with respect to executive sessions. First of all, when we speak of an executive session, what we basically mean is your board going into a private part of the meeting that others may not listen to, watch, participate in. And you can only do so for any of certain statutorily specified reasons. One is to discuss the reputation, character, physical condition, or mental health rather than the professional competence of an individual, or to discuss the discipline or dismissal of, or complaints or charges brought against the individual. So if that fits what you want to do on a given night, you have to give the individual written notice at least 48 hours in advance. And that notice has to explain to him that he has the right to attend. So he is there if he wishes to be with an attorney, but the attorney has the right only to advise him and not to speak to you. So he can't turn it into a trial. The individual also has the right to create an audio recording or a transcript at his own expense, and the right to insist, if he wishes, that the meeting be in open session. Another reason is to go into strategy discussions concerning collective bargaining or for negotiations with non-union personnel. And of course, you can go into it to discuss litigation, but the litigation has to actually be ongoing or at least clearly and imminently threatened. It can't be enough that somebody might conceivably sue you, because anybody can sue anyone for anything. You can even hold collective bargaining negotiations and negotiations with non-union personnel and grievance hearings in an executive session. And you can conduct a screening session for the choice of applicants. Now, this is an important point to go into about screening. Let's say that your board was going to appoint a new health agent. And you had a whole bunch of applications. How do you deal with that? Well, one thing you could do is just have your board look through them and the applications and discuss them in open session. And you could invite such applicants as interested you to be interviewed. Many boards don't want to do that. And the main reason is that in order to attract qualified applicants, they will promise that the initial screening will be done in executive session so that the world, including the existing employer of those applicants, doesn't know unless they are lucky enough to be among the, say, 3 or 4 finalists. The screening then cannot be done by the Board of Health. The initial screening in executive session would have to be done by a subcommittee or a committee that's created by you of non-members of the Board of Health to whom you delegate this screening function. Once an applicant has gone through an initial screening, he cannot be interviewed in executive session again. So the board, so whatever subcommittee you create has to come up with a list of applicants, again, at least 3, send them to you, and then your board, if you want to conduct interviews, has to do it in open session. Now let's talk about the mechanics of going into executive session. First, you've got to convene in open session the way we just did. Even if the only thing on your agenda is going to be an executive session item. The Attorney General says that in that case, the first item on the agenda must be open session so that the public knows they have a right to attend and learn at least the reason for the executive session. Then somebody has to make a motion to go into executive session, and it must pass a roll call vote. The chair must make some statements for the record in open session. One is that he must state the purpose as specifically as possible without violating the reason for the executive session. So if, for example, you're talking about litigation, I would recommend that you identify the case. If it's negotiations, identify the union. If it's to screen an applicant, identify the position, but not the names of the applicants. And then you have to state whether you will reconvene in open session, because you don't want the public to keep hanging on waiting for you to return if you're not going to return. And there are certain statements that have to be made depending on the reason for the executive session. If you're going into executive session to discuss collective bargaining or litigation, then the chair has to announce when you're in open session that an open meeting may have a detrimental effect on the bargaining or litigating position of the board. And if it's a screening committee, then the chair has to say that an open meeting may have a detrimental effect on your ability to obtain qualified applicants. And you have to keep minutes. You know that you do this, of course, with respect to open meetings. You have to keep separate minutes with respect to executive session meetings. And you have to keep these minutes separate, and all votes in executive session have to be done by roll call. Even once we go back, if we ever go back to regular, corporeal meetings again, once you're in executive session, you need roll call votes for any vote, even the vote to leave executive session and go back into open session. Now let's talk about these minutes. They have to identify all the members present and all the members absent. You have to record all votes. And again, since every executive session minute is by a roll call vote. You have to say who voted for what. You have to include a summary of the discussions, not a transcript, but a summary. And you have to periodically review the minutes to determine whether the need for an executive session continues or not. There are some times when I think the executive session reason continues indefinitely. If, for example, a board is interviewing candidates for a position, a screening committee is doing so, I would recommend that they never release the executive session minutes, because it could ruin the lives of individuals who were not chosen to be finalists. On the other hand, if you're discussing a strategy in collective bargaining, well, once the collective bargaining agreement is signed, it's too late. It's over. There's no legitimate reason anymore to keep anything secret. And so the board should vote at a future meeting to release those minutes. That's it in a nutshell. You have any questions? I'd be happy to try to answer.
Madam Chair, may I speak?
Yeah, Laura, please go ahead.
Oh, let me take that silly hand down. Thank you so much, Mr. Mullen. So let me just pose, it's interesting and unique to, well, it's not unique necessarily, but with a 3-member board, there are certainly times, so we really can't, with a 3-member board in open meeting, have a committee. Because that would be a violation, unless it became an executive session committee, right? Because we can't, that would be a quorum, and we can't meet.
Yeah,
outside of a meeting, right? So that's
right. No two of you can communicate
right.
on any matter within your jurisdiction except at an open meeting.
Right.
Right. And then if you decide to go into executive session, you have to go through these processes. But yeah, right.
So part of the reason why I asked you to give us a little guidance is because I believe that executive session is a tool to get some needed work done without, with, as you say, avoiding any unintentional consequences to information that would be shared publicly. So, we have taken a different course for hiring and screening, but I think we need to think about that model that you presented. And then what is confounding me is that there are matters that are important to the Board of Health that we sort of have cross jurisdiction with. So for instance, going way back, we had, when I first came on and you were here, there was a decision to regionalize and join with Melrose. And then later on, a joint with Reading. And it happened almost as an announcement and not as feedback from the board, because the jurisdiction was really with Board of Selectmen at the time and Town Council. And I'm wondering, in reflecting upon those processes, if we had an opportunity, if that situation came up again, if we could go into executive session just to freely discuss what that would look like, because it's kind of a negotiation. It's not, it's an intertown negotiation, or whether I'm just feeling like we're missing an opportunity to be appropriately active in town, for the benefit of the town, decisions that absolutely affect the department that we are the board of, but that doing so in open meeting may not be appropriate. But I'm trying to figure out how you would utilize executive session in that regard. Am I muddling that?
Well, I'm totally in sympathy, but the answer is no. You
Okay.
can't, you could not use executive session to discuss whether to ally with another town or city. Let me put it this way: the executive session sections of the open meeting law deal specifically with a situation where the town is buying or selling land.
Right.
And they say, and these sections say, if you're discussing the purchase or sale of land or the value of land, then you can go into executive session for that purpose. But they don't say anything like that about any other contract other than employment contracts like collective bargaining agreements.
Mhm.
So if you wanted to, if the town council wanted to discuss the possibility of purchasing or selling equipment, they'd have to bare their soul to the world, including the potential, contractors who might be selling or buying. Whereas if they were talking about land, they'd have an opportunity to keep their cards close to the vest. And what you're talking about is really a different kind of contract, but it has nothing to do with land.
Right.
And so there's no opportunity for us to enjoy secrecy.
Okay. What about strategy and mission? Mission, like re-strategizing a mission statement for the department. Is that, like 3 of us need to be in the room. Does that need to be open? Is it?
Yes.
Okay.
Yeah.
All right.
Yeah.
Appreciate that.
Yeah.
Elaine, I don't think I have any other questions.
Yeah, may I speak, Mrs. Linehan? Mr. Mullen, may I ask you this? The role, as I have understood in the 20-something years I've been in health and public health, is that the Board of Health is your policymaking purpose. That is our main purpose, is for policymaking in regards to health, infectious disease, anything that would reflect on the health of the community. Am I not correct?
Well, you're certainly right that the Board of Health has broad jurisdiction over matters affecting the health of the community, and that it is largely a policy setting board. I would note that in other towns that aren't blessed with a sewer system, as we have here in Wakefield, the bulk of what the Board of Health frequently does has nothing to do with policy. It's mostly approving septic systems.
Well, I consider septic systems rather. I'm bad tonight. I was just saying, as Laurel said, I think that sometimes it's not very clear as to what our role is. And if there is something that would come up that would affect a policy that we had here, that we had maybe implemented or had done changes to, and when we feel that that is happening, would we be able to go into executive session and discuss that as to whether or not we felt it was something that we should really be involved in?
No, unless you could fit it into one of these pigeonholes that I just went through, you wouldn't have an opportunity to do that. And stepping back, I think you shouldn't want to do that. You're public officials, and you want the public to know that you're thinking seriously about these issues. And you're not, presumably, when you make a decision like that, you're not talking about disciplining any individual. You're not talking about any individual's health. You're not tipping your hand in land negotiations. So you should discuss that vigorously, robustly, have a full discussion and let everybody hear.
But we would not be violating anything if something came up and we feel that it's something that we really have to bring to our table. We could discuss it there, and then if it was brought up maybe by the director or someone else on the board that they felt that it had to be an executive session, then we could table it and get your advice on it.
Yeah, I'd always recommend that you give me a call before you go into executive session. I think the opportunities for executive session for your board are so few that if you ever think you have a reason to go in, please restrain yourself and let me talk to you first.
Thank you very much.
Laurel, anything else? Any more details you wanted clarified, or?
No, I think that's sage advice. I think,
I think the last point kind of drove it home.
yeah. Well, and also, you know, we have really grown. Like, you know, we have changed the name of our health department to Health and Human Services. And so I was trying to figure out a couple of instances where I thought that we fit in there. And some of it, you know, may have been that we could have used executive session in screening, or at least clarifying with administration our understanding of, I don't know, Tom, I could be wrong, but, you know, our understanding of how to hire someone within the guidelines of collective bargaining and unions, because we're, you know, that's not part of what we do. We don't, you know, and we depend on town administration to do that, but I have been increasingly feeling like we're observing and not participating. So I'm trying to just make sure that we are utilizing open meeting law to best serve the town. And I think you really helped us with that, Tom. I really appreciate that.
Sure, happy to.
Thank you, Tom. Appreciate that.
Okay, thank you.
All right.
Take care. Have a
Good
lovely
night.
night.
I understand that our new wellness coordinator, Amy, you'd like to maybe take a moment, introduce yourself. You got another meeting I know you have to hop to. Welcome. I'm Candace, the chair.
Hi, thank you so much. Yep, my name's Amy Cervelati. I'm the new prevention and wellness coordinator. Super excited to be here and nice to see you all. I'm here for a little while longer than I have to sneak off to back to school night for my son, but I just wanted to pop in and say hello to everyone.
Great. Welcome.
Great to meet you, Amy.
Yeah. And maybe in the spirit of introductions, Jason, would you like to take a moment to introduce yourself? Jason is our new social services coordinator.
Hi, everybody. Yeah, thanks for the opportunity. Yeah, my name is Jason Stone. I've been a Wakefield resident for the last 19 years. I come to the Department of Health and Human Services from having spent the better part of 20 years in the substance abuse treatment and behavioral health field. So that's been a little bit of my expertise. But yeah, I'm happy to be here. This is, I think it's an exciting opportunity for the town to have this sort of position. So hopefully I do well by everybody.
Great. Welcome.
Thanks.
Any comments, anything you guys wanted to ask of us while we're all here gathered, Amy or Jason?
I can't say that. No, I think I don't know what I don't know at this point. So I'm happy to just sort of listen and take in all the information I can.
Okay, great.
Thanks.
Then maybe, and does anybody else here need to be introduced, Anthony? Anthony, no? I think you're frozen. We're very still. Melissa, why don't you go ahead and talk to us a little bit about the camp role?
Okay, thank you, Candace, and other board members. We just wanted to bring the topic of recreational camp fees to the board's attention, because the fee for a recreational summer camp has been $10 for a very long time. And even though some of these programs are the Boys and Girls Club in Wakefield and Camp Q, which is a Y camp out of Reading, and both of those camps do offer some reduced camp fee rates. They do collect a substantial amount of money every week per child. So, so we just wanted to talk to the board about there are 2 Wakefield camps and 3 or 4 Melrose camps. And so I just wanted to summarize briefly and say that for the Boys and Girls Club, there is an inspector review of all of the rules and regulations that are required by the state. And then as part of those regulations, the public health nurse goes in and reviews a number of items and makes sure that there are CORIs on file for the staff and SORIs, and that they have all their first aid certificates, that they have safety kits, that they have been trained for all of their received epi training. So that, pardon me, and for I'm sorry, and for the immunization piece, we follow the state guidelines and look at all of the immunizations that are required for a child to get into school for the appropriate grade level. And so for the Boys and the Girls Club, between myself and Sandy, it took us roughly 41 man hours to review all of the immunizations in that camp. And Sandy has specifics about how many children that covered. We went back every week to review new campers and everything. Sandy didn't come on till the end of July, so I had done 23 hours, and then she did an additional 18. And then for Camp Q, which is held at the church at the head of the lake, the Congregational Church, it took me 34 hours to review all those records. Plus, there's also an inspector review, which takes some time to review thoroughly. And we spend that same amount of time on other camps as well. So I just wanted to give you an idea about the time commitment involved. Sandy's going to take over and talk about some specific issues and concerns that we observed that take additional time. And then also we did a review of some surrounding towns to identify how much their camp fees are. So Sandy, do you want to go ahead?
Sure. First of all, I apologize. I have some internet connectivity problems in the building that I live in. So hopefully I won't go down again, but basically the camp director, the major problem that I see is with the Boys and Girls Club. The problem is for next year that there's going to be a new camp director. The immunization stuff that we have to look at is quite complex, so it's going to take a lot of time to train and get some additional systems put in so that hopefully we can make this a little bit of a smoother process for us and for the camp as well. Some of the issues that we think that we need to discuss with them are things like because of climate change, it's becoming so hot. During the summer, this past summer, we approached 100 degrees with high humidity levels. It's an outside camp. They're outside, the kids are outside all day, every day. They're at Moulton Park. Their base is at AmeriCal and they're bused over there, or actually the parents drop them off there in the morning and pick them up there in the afternoon. So we were having to conduct our review sitting at a park bench, and it was, I couldn't handle the heat very well. I can't imagine the kids running around could handle it well. So we want to address some of those issues. There's issues around where they go for emergencies, an electrical storm. There was an electrical storm when I was at the office one day, and I actually had to get in my car and run over to the park and found the kids under a tree during a thunder and lightning storm. So things like that, I really want to work with them and tighten it up. And I think once we do that, things might be smoother going forward. They kind of was loosey-goosey about where they go for shelter, for things like that, or active shooter, or any of those, emergency issues. So we want to work with them around getting really good signed contracts with the schools that are nearby where they could go quickly. So those are some of the major issues that we want to work with. The reason it takes so long to is because it's complex. And the people that are running the camps are fairly young, and they don't know the nuances of immunizations. They don't know all the time they don't know how many immunizations a kid has to have at a certain grade level. They're not aware of the brand names for these vaccines and which of those vaccines contain multiple vaccines, polio, MMR, DPT. So it takes a really long time to do those reviews with them to try to train them. So I did call around to other towns to find out how they handled some of these situations, and actually found out that their fees are much higher. I think Wilmington was $200 a year, and Stoneham was actually $200 a year for the permit. So we're hoping that you might consider increasing the fee to align us with other towns in the area, and to, put it in line with the work that we're going to have to do with them. Okay, did I leave anything out, Melissa?
No, Sandy, I think you covered everything. Melissa and Sandy both covered it, but I want to say thank you again. I mean, just a shout out to Melissa and Sandy and Aaron too, for putting in so much time over this summer to help with camps. A lot of camps are starting to get back into full swing, after the peak of COVID. So I think, just to go off what they said, some of these camps are going to need a little extra support moving forward, just to kind of get back up to some of the standards that we had already had established before. So it'll be good to kind of keep that in mind. Sorry, Laurel, didn't mean to cut you off there.
No, I was waiting my turn. The quick question: are any of so this is an interesting model that the actual grunt work is following on our department nurses. So these camps have not hired a nurse. Neither of these great camps.
No.
They have a nurse.
It's interesting that like such big groups, like Boys and Girls Club and YMCA, those are large.
Well, the other, so I just have a couple of questions for us to ponder on a practical level. I am absolutely in favor of reflecting the work that you do in a reasonable fee. I don't think that I have no issues with that. But are either of these camps ACA certified? Are any of them utilizing something called the Alliance of Camp Health Providers? It used to be the American Camp Nursing Association. There are tools out there for camps, something called Camp Brain. So, I'm wondering if we actually sit down with these camp directors, consulting, saying, okay, you need to invest, or it would be helpful if you invested in XYZ. So, I have worked with overnight camps where directors actually hire nurses, but also have admin assistants streamlining some stuff, and then a final look at nursing. So I'm feeling like the camps that you're describing are not utilizing camp-specific resources. I would expect Boys and Girls Club would be ACA certified, and that a Y, anything that has to do with a Y camp would be ACA involved, American Camp Association. And that if they aligned with that, like they have courses on what people have to do, that might make your job a little less starting from scratch.
I think, Laurel, also in working with camps, I think what the problem is that a lot of these camps are city or town run. And when they are, they don't tend to be certified with anything like in dealing with camps in the past. And what I found was we put in a system where they all had a notebook, and every year the camp director would take that, and before they would come to apply for a permit, they would put all their certifications in, all their counselors, copies of immunizations, and we set up a schedule. And what would happen is that all immunizations for those attending camps, including medication orders, because I can imagine you must have ran into that, had to be in a week before the child started camp. It's very complicated. Been there, done that. I feel bad for Melissa and Sandy. I know what it's like. Always spent Monday afternoons for many years in one particular camp. And it's very difficult sometimes, and especially after COVID, if we all know, and getting immunization records and getting people back in and getting people caught up to things. Schools and a lot of people are having trouble right now. So maybe sometime, I mean, I'm happy to help you, Melissa and Sandy, if you want to know. I mean, it worked. It worked for us. And we had at least 3 or 4 camps a year. But our fee was much more because it does also involve your inspector going out there, inspecting that kitchen. They're serving food. Where is the food coming from? Are they cooking or heating up something? Where are they storing a medication? Wilderness training. A lot of times you'll find with camps that go on a lot of field trips, we'll have camp instructors that are wilderness certified who are like a paramedic, something like that. So I'm willing to give you a hand if you want. Don't be afraid to ask me. I have nothing else to do.
Thank you, Elaine. Much appreciated.
Yeah. It's difficult for them because they hire seasonally, and they need a lot of support. I know that I was a camp nurse decades ago, and I know those, even today, they require a nurse.
Yeah.
I don't think the ACA necessarily requires a nurse for day camps.
Right, that's true, but I think offline, the fall symposium for camp nurses for camp health is coming up, but it might not be a bad idea if the health department had a membership so that you could look at their tools.
Yeah,
it's very I'll look at sending you the link.
Thank you.
These are all just Elaine and I being like, well, in our day, but this is new information. I've been very impressed, and
there is a pediatric course also coming up, Sandy. Melissa, you must have got the email for the pediatric immunizations. You may be able to sign Sandy up for that, to get that particular thing, and that would give you a lot of guidelines, Sandy, to pass out and to teach it. And a lot of problems, I don't know if a lot of people on the board are aware of, is that these camps change directors sometimes every single year, and that is a problem. And that's why sometimes having something in place like a notebook that's passed on from the director to director and then given to the health department so that we can review and give it back to them. It does help them a little bit too. They do need the guidance.
But both of these camps are under a bigger umbrella. And I think that's important. Boys and Girls Club have the ability and the experience to have administrators to do some of this. Like, in my mind, the department should be checking that the work is done, not doing the work. That may be a model that is not, is not realistic, but that would be my goal. And the YMCA certainly has camp standards, and it's certainly part of ACA. So I'm,
Sometimes does it matter where they are? Because I had a Y come in and run a camp for citywide, and they fell under our jurisdiction because it was a citywide camp. It was funded by the city, and the city ran it for them. It was like a contract. I don't know, Anthony, if these two have contracts with the town of Wakefield and city of Melrose, or they're on their own.
I don't believe they do, Melissa. Is that correct? They don't have contracts with the town.
I don't think they do.
okay. I mean, we have two separate issues. One is absolutely the fee should be bigger. I'm good with 200 if, that doesn't even reflect half the work. But I just feel like I'm wondering if we have some missed opportunities on working smarter, not necessarily harder, in regards to platforms that are absolutely out there and available for camps to utilize, but also putting some pressure on the higher, the higher umbrella. So even if boys and girls clubs have national stuff, it would be like, I just sort of feel like someone there, even on a regional or state or federal level or, national level, would not, I mean, I could be wrong. Everybody could just be doing it on their own and depending on individual departments, but for sure the resources are out there. So I will send you what I have for connecting, and then we'll go for there. But I am fine. Do you think 200 is reasonable, or are you?
Yeah, what do you propose?
I think 200 is a good amount. I'm
Yes.
making sure that they take it more seriously.
Yep.
I don't think they're even living up in some cases to their own standards.
Yep.
And is it just this one fee that you're recommending we consider, or are there other separate fees? Is it just one fee that the camps pay per season?
It's one fee per season.
One fee per
Okay.
season.
Okay. So do we want to maybe write up the proposed change, or is it something we could vote on right now?
This is a change to the permit fee, so I don't know that it would be very extensive to write up. We could write up a recommendation as to the change, if that would be helpful, because we kind of described the reasons why here.
And we could vote on it in October.
Yeah, we certainly have time.
Yeah, because we have enough until next season. So
why don't we write up the proposed change, and we could read it before our next meeting, and then we could put it to a vote in October.
Is there a document that we can either find, or you could send us, that actually is what camp directors are seeing from the town? Like, I'm not quite sure what the permit entails.
What we are doing is we're having them follow the state guidelines.
Okay.
There is an information form, and each of the camps are supposed to go through and follow it. I can send you all of the board what is required there.
Okay, that would be great.
And I'd just like to say, Laurel, that some camps are much better than others. The Y in Melrose is very well organized. They deal with a lot of kids. They have their notebooks. They have printouts. And the Boys and Girls Club in Wakefield is very haphazard.
Yeah. So I don't think people necessarily understand, there's lots of things going on. They may not know what the standard can look like. And so we have done this in food inspections, right? We've pulled in consultants, or we've had them buddy up, or we've at least offered other references, because, the quote of the night, Jason, is you don't know what you don't know, or how to implement that. So I'd be interested in hearing more about it. I have to actually sign up for the seminar, which is coming up soon. So I'll send you that as well, because it's just a wealth of information, and you don't have to be a nurse. It's, any camp director can get on it. So maybe we can just make your job better. And by the way, this is all the homework you have to be ready to do, and go from there. Because I don't know that. I mean, I know we've done this before, but I've never heard it be quite so big and quite so arduous. And we didn't have Boys and Girls Club 10 years ago, and so I'm happy to have them. But I think literally we had the sailing camp, and that was it.
I think another thing that we can do, closer to the start of the season, before all this is due, I think it might be a good idea, like you said, treat it like a food inspection. Maybe we bring them in, into a Board of Health meeting prior to this, and just kind of, set the expectations. Because, between seasons, we've already seen a change in leadership in Boys and Girls Club camp for Wakefield. Right after the season was over, there was an announcement of a promotion. So, we have different folks every year, right? So, not to say this is going to be the case every year, but it's just good to have maybe that meeting beforehand, and we can let them know what they need to do.
The state has required staffing ratios, and one of the camps actually had a number of the counselors go back to school, and they weren't going to be able to meet the ratios. So, we need to look at this and provide some more guidance, and then follow through and be strict about it.
They're not even strict with their own requirements. They say they try to get information before the camper comes, but oftentimes the camper shows up on Monday morning with half the documentation or none of the documentation around immunizations and all of that that's required. So they're telling us we don't allow that camper to stay, but I know for a fact that camper is staying without the information. So they're just not even following the requirements that they're aware of.
Their own rules.
Their own rules.
Exactly.
Right. Okay. All right. Thank you, Melissa and Sandy. Anything else you want to add?
No, thank you all for your time.
Thank
Andy,
you.
nice meeting you. We didn't really get, you didn't have, is this your first?
Yes, nice to meet you too. I think I'll be meeting you at some of the vaccination clinics.
Oh, for sure.
Yes.
Yeah.
I know, I got my new Board of Health swag, so I gotta use it.
All right.
My hat.
Thank you, Melissa. Thank you, Sandy.
Thank you,
Thank
everybody.
you.
Thank
Before
you.
we
Bye
go-
now. Have a good night.
Thank you very much. Any further? Why don't I just ask if anyone is on for public participation tonight? And we'll give them an opportunity, and then we'll move on to hear about Jade Gourmet. So if anyone is on who's interested in public participation tonight, please make yourself known. 15, okay.
Yep.
I understand you would like to speak about something a little bit later on the agenda.
Yeah, sure. I can wait until that item comes up.
Okay, thank you for that. I think that I'll make sure I give you an opportunity to speak, but maybe we'll just see if anybody's on for anything else right now. Great, okay. Thank you very much, Christine. Why don't we move on to Jade Gourmet? Dan, do you have some stuff for us about that?
Yes, hello, everybody. I think, do we have somebody from Jade Gourmet in the call? I don't see them.
They've been in and out, I believe.
Okay. Yeah, so on September 7th, I did an inspection over there, and it was not very good. There were a lot of things they need to improve on. And the reason I wanted to bring it up with the board in a meeting is because the past 4 inspections we have with them, they've also been struggling, pretty much all of those inspection reports. And a lot of the violations that I recorded in my past inspection on the 7th are repeat violations of prior reports. So I really wanted to speak with the person in charge. His name was Philip. I really wanted to speak with Philip tonight, just kind of to go over the report with him, and for everyone else, in case you were curious about what was questionable on the report, as well as I wanted to schedule a reinspection with October 3rd. But I mean, I don't see anyone in here right now, so I'm just going to assume they're not going to come back unless they pop in randomly. But yeah, I mean, like I could go through the entire report, but I figured I'd just save the time since no one else is, no one's there. But really, I mean, like this is a circumstance where like I really don't want to be lenient towards people that have a history of repeating the same thing over and over and over again. And it's just unacceptable to see something like improper dating or like no dating whatsoever, and it's been repeated on like 4 inspection reports in a row, so again, it's something that's like frustrating for me, but also like these are the things that actually matter when it comes to like making sure people don't get sick. Like you can't have consistently bad inspection reports. There needs to be some sort of consequence for that. But I digress. So yeah, basically I just wanted to bring it to the attention of the board that Jade Gourmet in the past has had issues. There's issues right now. And the day of the inspection on September 7th, I walked through with Philip, the person in charge, pretty much everything he needed to do. He has a copy of the inspection report. And again, it's already been like 2 weeks. So really he should be fine if I went and inspected like next Monday or something, but I'm even gonna be more generous and give him a little bit extra time for that. But he knows exactly what he needs to do. It's all explained on the inspection report. He has my number, he has my email. If he has any questions, he knows to contact me. That's about it.
Okay, thank you.
Yeah.
And I don't remember last time when we met, we talked about possibly compelling a restaurant to maybe get an outside consultant to support them at this stage with this many violations. Is that something that's maybe going to be part of your suggestion or one of the consequences?
The way I feel about it right now is after my reinspection on October 3rd, if there's anything repeated off of the current inspection form I have right now, I'm going to suggest they get a food specialist to come in and help them.
Okay.
Why are you waiting till October 3rd?
So I wanted to wait a little bit longer, just really, I mean, a part of it is I'm being a little generous towards him because I do sympathize with restaurant owners to an extent. It's some people struggle very hard with staffing. Some people struggle really hard just because COVID was difficult. Really, I could go back next week and that would be acceptable as well. But also I'm considering going back on October 3rd because now there's no one here tonight. So, I mean, I suppose I could call them and I could go back next week, and cut down the time a little bit, but I figured I would be a little bit generous because this is my first interaction with them as an inspector.
Yep.
I don't want to seem as though I'm a bully, or I don't want to seem as though like I'm not on their side. So that's kind of why I figured I'd give them a little bit more time. And again, just reiterate with them, like you have all the time, or not all the time you need, but you have plenty of time. There's no excuse for anything on this list to still be there when I go and inspect.
I think October 3rd seems fair.
Well, I hear you. I'm in mental health now. Jason's going to back me up with language, which is, I'm a good guy and, rather than I'm a good guy, so I don't want to be a bully, right? So it's, so I'm wondering, I think that there's, I think leaders who are firm and give clear expectations, or inspectors who give, you're just firm, but without emotion, which takes practice. I'm not saying that I'm good at it, but saying, yeah, I understand. Okay, how are you progressing? So even if it's not a full-on inspection, I'm wondering if you have time to go by and say, you know, we presented to the board last night. We saw you try to get on and get off. How's your progress? Because this is for the safety. This is for the success of your restaurant. Like, what's the goal? You know, the goal is we want you to have a safe and prosperous restaurant. So, you know, having measurable outcomes is a win-win. It protects the public. That's our job. But it also helps the restaurant in the long run succeed. So that's kind of where you can pull away. You know, I don't want to hassle them. And I know it takes a deep breath and you have to kind of like remember the objective. What is it? But I worry that when I hear stories like this, that it's you know, have no progress until the deadline, and then it's a scurry, and then is it lasting? So for the win-win, I'm wondering if it's a better strategy just to touch base. And you said that, you know, you might connect with them because they weren't here to speak, but just say, you know, where's your progress? What's your plan for your progress? Because this, you know, you want to stay open, you want to be a good business. Already, you know, this is a recorded meeting. Already they're going to be on public notice. So we want them to succeed because their success means public safety.
Right. I think if you wanted to check in, that would be fine. But I think if you gave them a date, and the expectation is that they need to address all those violations by that date, and that date is October 3rd, I think continuing to stand by that date. And like you said, it is a generous amount of time. And so if things truly aren't addressed by then I think, you know, you're well within your right to go ahead and to require them to make some real changes. Like, as you said, in hiring a consultant.
Elaine, do you remember years ago we had a hearing with a restaurant that was not being supported by their corporate office? I think that they were trying to cut their legs out, you know, out from underneath them, and it was hard. It was hard to hear about their struggles, but the bottom line was the health department isn't responsible for their finances, or, you know, like bottom line is safe is safe. So we have seen this before, and I think that we have to kind of keep our eye on the mission. But you're doing a great job. I'm hearing fabulous things, and you know, I hope they're understanding you. Is there any kind of language barrier?
No, not really. No, Philip was, I don't think we had any issues with understanding, so.
Are they the same ones that have been present, these violations? Were they present like a year or two ago too?
Yeah, I can actually, specifically, I can tell you when. So the one that was repeated the most was improper dating, or pretty much no dating whatsoever. And that was repeated on the inspection report from April 2021, October 2021, July 19th, and January 2018. And on the inspection report I did on the 7th.
Have you ever seen any kind of an improvement, Dan? I mean, seeing that he has tried something and it didn't work, it failed. I mean, since you've been there, have you seen anything?
There was some things that were cleaned up, a slight amount, but again, like not much of an improvement. A lot of it too is more not so much critical violations, but also better business practices. So just kind of general cleanliness of the restaurant. You know, his issue with a lot of things is improper storage of utensils, along with just not really maintaining like non-food contact surfaces like walls, floors, making sure they're free from debris and dirt and buildup and stuff like that. So like that kind of stuff can take a bit to really fix and address, but you know, there hasn't really been a large improvement since. But also I haven't been back, you know, I only went back once since the original inspection, and it was like a day or two later.
Are they the type that you have to take one violation at a time and go back the following week to see if that violation is done and more or less handle it like that? Like sometimes I've seen in restaurants, especially when you talk about walls and stuff like that, you know, them just close down for 2 or 3 days, call in a cleaning company and have everything done. So that violation is gone within a 48, 72-hour period. And that gives them the opportunity to go on to another violation to correct that. And maybe, unfortunately, sometimes weekly inspections, which take a lot of time, they really do, but a quick, even, you know, unannounced weekly walkthrough, you know, maybe may work for the next couple of weeks until you get there for the third. I don't know. That's just a suggestion.
Dan, before you keep going, I just wanted to, I mean, I think, Elaine, you're right about that. And part of it is, you know, we have to kind of balance, you know, resources that we do have, right? I mean, Dan is, you know, very efficient in what he does in terms of getting all the inspections done. But at the same time, you know, we have to, you know, kind of find a way to be efficient with his time. And, you know, I get the whole, you know, one step at a time, because I think a lot of the things that we face in the health department, a lot of different issues that we run into, you know, a lot of the time is overwhelming when you have too much to fix at once. But at the same time, I mean, we have to realize these are the same, you know, these are the same violations almost every time we're going back, right? So it's not as if they don't know. It's just that, you know, there's some part of it where they're not, you know, addressing the things that have already been told them multiple times. And, you know, in the past, we already know that there's a good track record when, you know, previous inspectors like Coral and others, you know, they've always done a good job of education first, making sure that, you know, everything is addressed with them. So at this point, not that we want to be punitive, but at the same time, we want to be a little bit more, you know, stricter with this and make sure that they understand that we are serious about, you know, the public safety part of this.
And do I remember right? Is this primarily a takeout restaurant? Like not a place where folks typically sit down to eat?
Entirely takeout.
Yeah.
Yeah.
Not that that makes any of this less important to address, but I wonder, you know, there's probably not a lot of the public who are sort of raising flags about the cleanliness and the appearance of the restaurant since they're not staying there.
Right. Yeah. And I will say this, you know, like it really is case by case with restaurants and how they react to enforcement. You know, like some places really what works for them is they shut down for a couple of days and they go through everything on the list and they just get it all out of the way at once. Some places you really need to stay on them and you need to go back weekly and you need to just constantly be like right behind them, looking over their shoulder and making sure that they fix these things. With Jade Gourmet, based off of their history, it seems as though they have an inspection. It's a bad one. Enforcement goes, you know, like there's a reinspection. They enforce whatever needs to be enforced. They fix it at the time. And then by the time they need to be inspected again, because they're a risk 3 every 6 months, it's the same deal. It's just that it's cyclical, you know? So, and the thing is too, a lot of these violations are things that are easily fixed, like improperly storing a knife jamming it between a pipe and a wall. Like you can just go to Restaurant Depot and spend $70 on a stainless steel knife holder, and then that's never an issue again, you know? So.
And the dating, isn't the dating, I'm not really sure how it works, forgive me, but like, is it just writing the date on the, yeah. Okay, right?
Yeah, so
like the cost of a marker, right?
Yeah, pretty much. Like if you have TCS foods and you open the package or you start prepping it, you take it out of the original container. If you're going to store it for longer than 24 hours in your restaurant, it needs to be dated. Whether or not you want to take some tape and a Sharpie and write the date, or if you want to go to Restaurant Depot, they sell stickers with the dates already on them that you could just stick on the food. It's really not a challenging thing to do. And there's really no excuse as to why it should show up 5 inspection reports in a row.
And not a big financial commitment for the restaurant, really.
It's not much of a financial commitment whatsoever. These are pennies compared to what they spend on product, you know?
So what's your threshold for forcing a close down?
I'm sorry, could you repeat that?
So what, I mean, we've had, like, the state has made us close people because there's been an outbreak of some, you know, an organism. how much leeway do you have, like, what is your threshold for saying enough's enough, you have to close and fix this? Like we're very clear with tobacco, people who sell tobacco underage, but restaurants, I think there's a lot of leeway. So,
Yeah.
it's not a bad idea before we leave this topic to say,
Mhm.
what's your go, no go?
In my opinion, if you're going to shut down a restaurant, it has to be either for, you have rodents or pests in the restaurant, you have a sewage backup, they don't have power, or they don't have hot water. If you're going to shut down a place for something other than that, you really need a solid history of just non-compliance and just constant pushback. And again, because this is the first time I've ever dealt with them,
Right.
it's hard for me to deem them as like reprehensible for this,
So it's just nice to put it out there. It's just
Yeah.
nice to go,
But
yeah,
as the
what's plan
enforcing,
B?
yeah,
Yeah.
but as the enforcing board, like we're the ones that permit them to operate. If
Right.
we feel as though they're not doing their duty and they're not operating within the food code, which they're not based off of the inspection report, we're the ones that decide whether or not
Mhm.
it needs to go, or they need to be suspended for a weekend, or whatever the case may be.
Okay.
Mhm.
Keep us posted.
I would say, for an example, sorry to keep
No.
rambling, but I would say, for an example, if I go back on October 3rd and everything on the list isn't addressed, or at least the things that are important, not important, but the things that are critical on the list,
Mhm.
if those aren't addressed, then I would consider suspending their permit. Absolutely.
For a day, for 2 days, what, like,
For weekends.
okay,
Yeah.
okay.
You want preemptive support?
I might need that, yeah.
Because we're not meeting until after that.
Yeah.
All right.
Anything else, Dan?
No, that's it.
Okay, I'd be interested to hear what you find when you go back.
Absolutely. I can send out an update email to everyone.
Cool.
Thank you, Dan. Always a pleasure.
Thank you, Dan.
Thank you so much.
Good care.
All right. I know we have guests to discuss, I believe, our last 2 agenda items. The wood burning and the delayed start time. Why don't we? Alexis, I understand you're here, and Catherine too, to talk about the delayed start time. Are you guys ready to go, or would you like to wait until after? I feel like you guys can go next if you're ready.
I'm ready. Yes, I'm ready to present.
Great, okay.
I just I need to share my screen because I do have like an actual presentation. So if you could make me a host so I could share my screen.
So that's gonna be tough.
Who's the host?
So the host key is not working. It doesn't have enough numbers. We don't have a host key tonight unless something has changed, Cindy, or
I think maybe I can share my screen.
if there possibly is no host, Alexis. So if you're able to just go ahead and kind of hijack the meeting, you're welcome.
Candace, I text you the key again.
A new key. Okay, let's see.
The screen sharing is disabled until the host grants the access right now.
So the thing is,
There's no host.
the keys you're sending me are only 5 numbers, and a host key has to be 6 to 10. So when I put in 5 numbers, it won't accept it unless somebody knows a better way than I do.
It's 6.
The one I have is 38101. That's 5, and 30101. That's also 5 numbers. Am I missing something?
Oh, hold on. I sent you 6 and it's,
Did you email me?
no, I
Alexa, it's just
texted,
for the fun of it,
but
kids, right?
I don't think you're supposed to say it out.
Sorry, those don't work anyway.
Hold
Try
on.
to-
Oh, no, I see claim host.
I've been trying to since we sort of started, but those numbers, I can't even, it has to have a full 6 digits.
Wait a minute, hold on. Who did I text it to?
I can present without the presentation if you'd like. I can just read.
No.
I'd love to see your presentation. I'm sorry that we are not as organized as I had hoped.
Send it in again.
Okay.
I might be able to email the presentation to you.
That was exactly what I was going to say. Good. That was a good idea, Catherine. If we just email to each of the members of the board, then you guys can just kind of follow along in the background.
Hold up. Wait a minute.
I can't wait for us to get in the same room again.
Oh,
Here we go.
I'm so sorry. Thank you very much.
Now you need to share.
All right, and so. Alexis, you are a co-host.
Okay, thank you so much.
Thank you. Thanks for everybody's patience, and thank you, Cindy.
Okay. Sorry, I'm just trying to figure out what screen to share. Can you see my screen?
Yes.
Okay, great. Okay, so while this loads, I'm here to talk about later school start time, specifically for the high school, and whether or not we should have them, which I think we really need them. There are many pros and cons of later school start times, so I'm here to show the statistics about why we need later school start times. And all these statistics I'm about to show you are approved and looked at by pediatric specialists and sleep medicine organizations around the country. Some health risks that are associated with lack of sleep is being overweight, drinking alcohol, smoking, and using drugs, which is obviously really bad for teens. Also going along with all the hormones we're going through and just not getting enough sleep. We obviously do not want any of these things happening to teens because they have to get up for school way too early in the morning. Adolescents who do not get enough sleep are more likely to not engage in daily physical activity, suffer from depression, and engage in risky behaviors again, like using drugs, smoking, drinking, etc. And they also perform poorly at school because many kids are not awake for the first part of the day.
Hey, Alexis, apologies for interrupting. I can see a screen, but I only see black. Does anybody else see anything? I wonder, it does say that you're sharing.
Maybe because here I can get. Can you see my screen now?
No, I can just see that you're sharing, but what we see is a black screen.
Oh no.
So we're pretty smart. I've got what you're saying so far.
Yeah, if you just want to carry on, like Catherine and Anthony said, you could just email it to us after and we can review. As long as you can see it and carry on with your presentation.
Okay, great. Let me just, I don't know how to get back into the Zoom, but so now I'm going to show you some statistics that relate to later school start times. One was that there was a study conducted on students in many different states, and their school start times were pushed back later. And after these school start times were pushed back, there was a significant increase in the average graduation rates that year. It went from 77% to 88%, which is an 11% increase across all the states that changed their school start times, which is a very large increase. Another statistic is that as kids become teenagers, our melatonin release happens later at night and then later in the morning, which makes it harder for kids to stay awake in the morning since their melatonin hasn't worn off yet. And then kids feel they don't need to go to bed till later at night because their melatonin hasn't been released yet. Therefore, kids are not getting enough sleep because they're staying up later and having to get up super early in the morning to get to their 7:30 start time. And an actual experiment that was conducted in Seattle, Washington, 2016, when they changed their school start times to later, this change showed a 34-minute average increase in student sleep time, which doesn't seem like a lot of time, but 34 minutes is a really positive impact and can really make kids feel more awake during first period and second period. Some more statistics about later school start times is the American Academy of Sleep Medicine reports that teens should get 8 to 10 hours of sleep per day. And when kids do not get the right amount of sleep, they perform poorly in school. Like I said again, many kids are asleep in first period. I know I feel tired at 7:35 in the morning trying to be awake to learn. And kids are just really not fully awake yet at the school start time that we have in Wakefield. Another project that was successful was at Nauset Regional High School in Massachusetts, and they shifted their school start times later and found that there was less failing grades, decreases in tardiness, and decreases in suspensions, which really improved the school and just everything about the school in general. And lastly, there was one statewide change made in California, which was actually the first state to push later start times back to 8:30. And they said it was a law that no schools could start before 8:30 in the morning. And this change showed that there was like an average increase across the state in sleep, better grades, and decrease in teen car crashes. And I think that last statistic is really important because I know many kids who drive to school super early to get a parking spot in the parking lot, and they're not awake at 6:50 in the morning trying to get to school. So if kids got even 30 minutes extra of sleep, it would really help them decrease these teen car crashes. Now I'm gonna just give an overall summary of the pros of starting school later, which is many kids stay up very late doing homework. So having a later school start time will allow them to maybe finish their homework in the morning or just get a little extra sleep after they're up late at night doing their homework. It will also allow them to have more time in the morning to get ready and have quality time with their parents, because many kids don't get home till 5:30 at night after school because they have sports and extracurricular activities. So just having that quality time with their parents in the morning could really help. And also many parent journalists, experts say that their kids are not even awake in the car in the morning. So they're definitely not awake during first period, which can really affect their performance in school as well as their learning experience. And lastly, when kids have later start times, they have more time to get themselves ready, eat a good breakfast, and just do all their morning routine more relaxed. And eating breakfast is one of the really important ones, because I myself included, I sometimes don't eat breakfast because I just don't have enough time in the morning. And it's really important to eat that meal during the day. And moving on, I'm going to talk about maybe some challenges that have come up when schools have pushed their start times later, but I think can be resolved really easily. One challenge that could come up if we change our school start times is parents who need childcare in the morning and the afternoon might have to switch their schedules around. But I think that this problem could be resolved because we do have many after school programs, before school programs, and Boys and Girls Club after school and before school to help out parents with childcare. And another issue that might come up is busing issues. And many schools who push their school start time later said they could not afford busing anymore because of their later school start time. But many schools in the Middlesex region have already pushed their start times later, so this would not be an issue for Wakefield because we just be with the majority of the schools who are already in our region. And one last challenge that may come up is that later school start times also means a later end time. But even if we pushed the school start time till 8 o'clock or 8:05, that would not create a big problem after school, since extracurricular activities and sports could still go on at their same times, since a 30 minutes doesn't change a lot of it doesn't affect a lot of after school activities, but this 30-minute later start time could really help teens get more sleep. And to back up my evidence, I made two surveys, one going out to Wakefield High students and then one going out to students in other towns who also have later start times already. And I asked them these questions and got their responses. And so for my Wakefield student responses, I asked, would you rather have a later school start time? And 93% of the student surveys said that they would rather have a later school start time. They were also asked, what would your ideal start time be? And 53%, which is over half of the students, responded that they would rather have an 8 a.m. start time, which is only 30 minutes later than our regular start time. And when asked what pros and cons there would be of a later school start time, most common pros mentioned were more sleep and getting to finish your homework in the morning. But one challenge that was listed was school sports starting later, which I already addressed, would not be affected that much if we started only 30 minutes later. And then for my survey for students in other towns who already have later start times, I asked them if they like their later start time, and 100% of students responded yes. And the majority of students who took this survey start at 8:15 in the morning, which is 45 minutes after we start our school day. Some pros and cons that they listed of having a later school start time is one pro that all students listed was getting to sleep in, and one con that they listed was they get out of school later than other schools. But if we moved our start time later, we would also get out at the same time as them. So that would not be an issue anymore. Lastly, just some recommendations from the American Academy of Pediatrics highly recommends that start times for middle and high school students should be no earlier than 8:30. And many states have put this law into effect over the years. And just lastly, to round this up, just overall, this having a later school start time, even 30 minutes, would improve students' mental health. Students would have more time for homework, students will get better grades, and there will be less student car accidents. Also, many schools in the Middlesex League, like Burlington, Melrose, and Masco, start their school day much later than Wakefield. So this would just make sense for us to change this later school start time for the overall well-being of our Wakefield High students. Thank you.
Thank you, Alex. That was thoughtful. That was very thoughtful.
Well done, Alexis. Thank you.
Excuse me, Alexis. Catherine, anything to add?
No, I just think Alexis did a wonderful job kind of summarizing it. And the reason why the Youth Action Team took this on is because they're dedicated to the health and well-being of their peers. And they wanted to start with the Board of Health on this because the primary reasons for later school start times are health related. So they wanted to present you with this important information, and the fact that so many districts around us have already made that change primarily for health reasons. And I do have to note that one of the reasons this piqued my interest in addition to hearing all of California's decision was my 9th grader is out at the bus at 6:30 in the morning in the pitch black dark. So I'm seeing it in my own household firsthand.
Yeah. Can you guys be specific about what you'd recommend here in Wakefield? Like the specific change from what to what?
I think that the most ideal situation would change the start time from 7:30 to 8 o'clock or 8:05. Because this like minor change would not disrupt really any after school activities or jobs that students may have to get to, but it will also allow students 30 extra minutes of sleep, which I think there's a big difference between waking up maybe at 6 o'clock to 6:30. So I think this change would really positively impact our students.
Okay.
I feel like school committee has at least grazed this subject before, but it hasn't come, I think with all the other challenges, it kind of got backseated. What time the elementary schools start, Catherine?
Around 8:45.
Okay.
Is that correct, Candace?
My kids are in Woodville, and they 8:40 is
8:40, yeah.
is Woodville for elementary. Middle school is middle school the same as the high school? 7:30.
7:45.
7:45. Okay, so 7:45 for middle, 7:30 for high school, and I'm guessing all the elementaries are probably 8:40.
Yeah. So Melrose, so I'm just thinking out loud to logistics. As a pediatric person, I understand the data that you presented. I absolutely believed in it. Our colleague Frank from the Board of Health and a physician in Melrose spearheaded this and made it happen. He was passionate, and I've not heard. I've not spoken to him because we just mostly saw each other at COVID vaccine clinics, but it would be nice to see. I'm just wondering, if we can help you think of any other pros, cons, or pushback that you might have. And one is sort of negotiating element, people who have kids at both time levels and busing. And, if you follow the data, you would just actually flip it. The little kids are up and ready to go, because their circadian rhythm is actually earlier. And I'm not quite sure how we never figured that out. And one thing that you didn't say that has come to mind in other conversations, but relates to traffic accidents is you got the little kids to school, they're all tucked into school. And then then the younger drivers are on the road. So you're kind of protecting that cohort, maybe. I'm not sure that you could track that, but theoretically.
And maybe another pro that I read about too is for high school age kids that are possibly looking after or able to look after a younger sibling, if the high schoolers started later, they would be able to help that younger sibling get off to school if the start times were similar to, which is kind of what you're proposing.
Yeah.
And we are lucky in Wakefield. I know a lot of towns don't have Wakefield Academy, which is an amazing resource for families before and after school. I know personally. So I think it helps that we have that when we make an argument for how important this could be.
So we don't have the power, but we have the ability to endorse your proposal.
I believe in Melrose, the Board of Health made a recommendation to the school committee, but I'm not 100% sure. But I believe
That's correct. So I spoke to Frank. So Catherine, you've connected with Frank and Nancy about this. I actually spoke with Frank recently. They did make, I guess you'd say, a formal recommendation to a school committee to consider these points that Alexis laid out. I think it's possible for the board. We can discuss some of these points and to eventually come to a recommendation.
But that was not student driven. That was Frank driven, right? Their effort.
I believe so, yes.
So
could you do a joint recommendation with the youth action team and the Board of Health?
I think we could do whatever. Sure.
Why not?
Yeah. One of my thoughts is we endorse, like recommend or endorse. I can't decide what sends a better message. It's semantics. So I'll do whatever you think is most helpful. I'm in.
Well, semantics are important.
If we endorse them and have them present this, that they approached us and we endorse them to go forward and to present it to the school committee. I think that would be the way to go. Am I not right, Anthony? I think that's what Frank did.
It gives to endorse it, to me, indicates that we are respecting the hard work that you just did and that you own the presentation.
Right.
We didn't just sit there and go, oh yeah, we think it's a great idea. We're respecting your process and how hard you worked.
And this is a youth-driven movement here, which I think is important to.
I think that is, and the fact too, Alexis, that you now have data. If I'm not mistaken, I believe when Frank first approached this with us, it was brand new and there wasn't that much data to go by, but he waited quite a while, I think, and gathered it before he presented it. But he presented it, if I'm not mistaken, I think he presented it as a parent, not as a board member or something like that, because at that time there wasn't that much data and he had it medically, he had it. And he had gotten a lot through the data on his own. So he presented it that way. But now there is data. I mean, it's been around for what, maybe 4 or 5 years now, the changes have been coming about.
What time do they start in Melrose? Do you know?
I'm pretty sure it's 8:15 because I think most of the kids who took my out of town survey were from Melrose.
Okay,
I think it's 8:15.
okay. And they've had that start time for a couple of years?
Yep.
Okay.
I believe we have one, I think we have, I'll confirm with it, but I think we have one school that starts at 8:03. And I think that might be the Franklin.
Okay.
That's an elementary school.
Yeah.
Yep.
So the data is about adolescence, and switching, you're absolutely right. You know, you use the word melatonin, but the easier word to say is circadian rhythm. But you're absolutely right. There's other interesting sleep work that just talks about, you know, adults who have to get up early to go to the airport and they are physically sick. It's actually harder to wake up and break your circadian rhythm than it is to stay up late at night. But let's not confuse things. But there's such deep data in this, and it is so important. So do you want a motion to endorse?
Or what if, are you
Or
guys
do you
able to write like a recommendation and then we could sort of take it from there? Like perhaps we could, if the youth action group would be able to write a recommendation and then the board could endorse or support that recommendation?
I think that would be a good idea. I'm actually going to be speaking with Doug Lyons next week. I've already made him aware that we were doing this presentation with the Board of Health. But if possible, maybe if we could work with Alexis and Catherine and draft up a statement for you guys to endorse for next meeting. Would that be appropriate?
Yeah. And are we hoping this would be something that may be able to happen next September? Or
it's ultimately a school committee decision.
If like, is that what we, you know, ultimately hope? Okay.
Were there any, who else, did you have anybody else in mind, the youth action team to present this to with all this data besides the, school committee? Were you going to present to maybe town council or have some type of a public type of thing or some information published somewhere?
Alexis, do you want to answer that?
I mean, I'm not sure if we had any other presentations planned yet. I think because I just put this together in the past couple weeks, so I wasn't sure how many more presentations I was going to do before. Yeah.
Let's hope it doesn't get to town meeting. Let's hope it just be
Right. This is a school policy issue, and I believe also he is the contract negotiations are happening too, because that would be part of the teachers. So that's why the timing, there's just a lot of factors that some of the busing and things like that. So these are all things that's really school committee and some of their subcommittees will
right. And
have
I was
to
about to
consider.
say, you know, before you go to a full meeting, I definitely would recommend that you reach out and have a little chat with individual school committee members. And you can say, you know, we presented this to the board. They, you know, wholeheartedly endorse it. We, you know, they know it's, you know, ultimately a school logistical issue. And, you know, you can always do that. I don't think people use that, you know, understand that you can talk to committee members outside of their meetings rather, you know, with these big important presentations, and kind of the individual conversations are really helpful, because they may say, yeah, you haven't swayed me yet. Come back with, you know, XYZ answer. So I would just recommend that you shake some hands and have some conversations with current members, just to see, you know, if you can get a feeling of how it's going. And can I tell you how impressed we are as board members? And I'm sure I can speak to, you know, from the people I know on the school committee, how heartening it is to have such a great presentation come from our high school students. So well done. And it, you know, you are our future, and if you want, you're the expert on how you all feel in the morning, and I'm good with that.
Agreed. Okay. Alexis or Catherine, any other points or any questions you have for us? Could we clarify anything from our perspective?
No, I do want to say that Amy is the youth council advisor, the youth action team advisor. So she's really the one that's working with Alexis and the team on this. So I just do want to give her credit for her work with, and Amy is a former teacher too. So she was the one that spoke to the teacher's perspective of a first period class in their engagement versus a third or fourth period class. So we'll work with Amy and Alexis to continue this work, but thank you for the recommendations. And again, thank you, Alexis, for all of your hard work in the middle of a busy soccer season and school season and everything.
Thank you for your help, Catherine.
And Alexis missed a pasta party tonight to present to you.
Oh my gosh, a pasta party.
Oh, that's just wrong. Well, good luck in the game tomorrow.
And please send your presentation, or Catherine, if you're able to send it to us.
Yeah. It should be in your inbox right now. So
oh, all right.
I sent it a little while ago.
Thank you. All right. I believe we just have 2 more items on our agenda. The wood burning and Anthony's health director's report and actually
approval minutes.
And the minutes, right. Thank you. Yes.
Do you want to do minutes first?
Yeah, we can. I believe that they seem pretty straightforward. Let me pull them up here. Laurel, Elaine, anything?
No, I make a motion to accept the meetings as presented.
The minute says as written. Okay.
I'll second that motion.
Great. All in favor to accept the minutes as written?
Corville, aye.
All right.
Linehan, aye. So moved. Excellent. Anthony, do you want to outline the next item on the agenda, the wood burning?
Yeah, so I just wanted to go over some general things, and then I was going to let Christine kind of speak about it as well. I know Christine's here to talk about that too. So
great, and thank you for being so patient, Christine.
Yeah, so in general, you know, as we head into this kind of cold, we're starting to head into the cold season here, right? The heating season. So we want to kind of bring to the attention of the town, you know, in terms of best practices. You know, I believe every year we have folks that use a variety of different ways to heat their homes, and just to make the public aware of some of the risks associated with some practices. So heating equipment actually causes one in 7 home structure fires. This data was from a 4-year span from 2014 to 2018. And this had resulted in, this was the result of 19% of home fire deaths were a result of heating equipment use. If we want to dig a little bit further in terms of what the risks are, wood smoke burning indoors is also a huge impact on heart and lung health. And so we want to make sure that fire department takes a lot of this responsibility as well in terms of outreach and response. We want to partner with them to maybe put out some materials before the heating season really gets going here to educate the public on some of the risks, some of the best practices. And if they have any concerns or questions, they can always reach out to us or fire department to really address those concerns. So I'll kind of let Christine kind of go from there. If there's anything we can address afterwards.
Okay, well, I didn't realize I would be giving any kind of presentation, especially going after Alexis. I feel like I'm just not worthy. So
the hard act to follow for certain.
It's more, I really was interested in what you were going to put forth, Anthony, and what the Board of Health and your department could do on this issue. First of all, just thank you for your service, all of you. And I do have a public health and environmental health background, and I'm especially interested in this issue of wood burning. I studied particulate pollution for a long time, and I was just hoping that the board would see the wisdom in educating the public about the adverse health effects of wood burning, residential wood burning for heating, not just, having a fireplace or a fire pit outside that they use occasionally, but I think there are people I know in my neighborhood, unfortunately, that embarked on this residential wood heating, and it's just been very problematic for me living right next door to them. I think a town with the population density of Wakefield, that's like 3,700 people per square mile, and it's probably more than that because the open space is probably factored into that. Some of us live like 50 feet from our neighbors' chimneys, and I know myself, getting up there in age, and in my neighborhood, there's a lot of elderly people, and so we know there's a lot of evidence about the not just respiratory effects, but cardiovascular effects, blood pressure, and especially sensitive populations, older people, children, not just for the indoor environment, but for the outdoor environment. There's just it's really worrisome. Today there was a big article in the Boston Globe about the high costs of heating and what are we going to do in this next season. And I'm just concerned that people are going to be turning to alternatives that are not considered clean alternatives for various reasons, and looking to burn wood. And I think it's important to really send the message that this is not a healthy alternative. This is not something, we're not in Vermont, we're not in Canada, up in regions where, there's a lot of space between homes. So those are some of the things that concern me. And I know that there are policies the fire department has for inspecting wood stoves, the place where they're going to be installed, and then inspecting them after they're installed. And I don't know how they find out that someone has installed a wood stove. I think it just is, if someone decides that they're going to have the inspection, they call the fire department, but a lot of things are slipping through the cracks. And so I think there are uninspected units out there. And I think people aren't necessarily informed about what kind of wood to burn. I know I've seen this, people burning green wood, that's not properly seasoned, and it's very, very smoky. I just have had firsthand experience with this. And so there are some things on the books right now, policy, the fire department, but the DEP has clean air regulations that address residential wood burning, and the 310 CMR 7.06. But when, it's really up to the boards, the local boards of health, to enforce those. And I know it can be challenging to enforce something, and how does a board even get alerted that there's something to enforce unless, a neighbor calls or the fire department shows up? It's putting the onus on neighbors to make you aware of that. So I guess I just am looking to hear if there's any kind of strong message that can be put out about requirements from the fire department, about the DEP regulations, not just saying, be safe, but letting people know this is a health hazard, well established, American Lung Association, EPA, lots of journal articles and studies on this. Let people know in a strong way this isn't a good direction for you to pursue. And if you do so, there could be some regulations. There are regulations that you have to abide by. And so that's I'm just kind of asking the Board of Health to kind of prioritize this, or take this on, and recognize this as a public health issue.
Thank you, Christine. Just kind of two things towards the end there I wanted to kind of explain before the board kind of starts talking about this. So two things you brought up in terms of notification. So, not that this is completely separate from everything else that the Board of Health works on, but in general, when there are environmental health concerns, we normally do get notified, usually by a complaint submitted by a resident. I understand what you're saying in terms of putting the onus on, kind of residents telling us of conditions, but just due to the nature of our work and the the limits of staffing we have, we aren't able to do kind of, surveillance work in that aspect. But what you're saying, with the proactive kind of messaging and public health kind of education and awareness, I think it's important work, and we're looking to do that, and for a variety of issues, but this being one of them. So.
Thank you.
Oh, Laurel, I think you're muted.
Meeting's getting long. I'm losing it. So in the big umbrella of environmental health, and when I got on the board, I said, yeah, man, we're responsible for a lot of things, and we are the local arm of the Department of Environmental Protection. But we, I think we come at it more from unless it's a true policy. I would never want to make a policy on this without conferring with public safety and fire, not to mention maybe sustainability committee. But we just, I don't know, Elaine, if you remember this, but we had, is absolutely, changed my behavior around gas stoves, because, we had a great person, present, and just, the fact that you should always be venting. And we have building codes that don't require necessarily a vent, or you have that, over the thing microwave where it doesn't go anywhere, just kind of gets screened. And so I've become a little bit vigilant about, having a very powerful fan and making sure it's on. And, people are like, oh, I just thought you did that if you burnt something. So, just as an education piece. And I think we would get more traction. We are going into a very expensive fuel year. And there's all, and though I agree, kind of with the idea that we need to make some movement here, I am a bit reticent on regulating people's wood stove use. I just feel like we would get, I just can't even imagine the pushback, which may then may, make the problem worse. So I think we just need to kind of read the behavior in town, but an education piece where you say, okay, if you're going to burn wood, how can you mitigate some of these issues? Avoid, certain days. Watch out for green wood versus hardwood. Like I'm envisioning that, we find whatever is out there, and I know there's some stuff out there that we throw on a table for town day if we're having a table, or that we bring with our education stuff at flu clinics, which we should probably talk about that. So I'm thinking kind of like the whole healthy air thing. Does anybody know when, there's always a health themed week or a month. Does anybody know when? Well, heart is in February. When's lung?
Lung is usually, I think it's January, because I think that's when the fire departments do that stair climb, the 50 stairs up in Boston is usually. And in dealing, Christine, in the past, my last 20 something years here in public health, I've dealt with the problems of people with wood burning stoves. And sometimes it is the fact that maybe they don't have the right education, or they forget what they're burning in there. And most of the times, I think we as health departments get our insight from the local people. It's the person next door who keeps smelling it or seeing the smoke, and maybe has called the fire department because they're concerned. They don't know what it is or what it comes from. And then they go in. And I know, if I'm not mistaken, I think last week in the item was the article. There was some mention from the fire department about open burning season and what to, do.
Yeah.
So maybe, and I know And I know that that's what happens with wood burning stoves. I've seen it, that I've sent inspectors down and there's nothing wrong. Everything is fine. But that person has probably put the wrong type of wood into that stove, okay, and burnt it. And they may never do it again, but they have to be re-educated. So, you know, we as a health department sometimes we stress on the fact that people need to be educated. So as Laurel mentioned, maybe that's something that we could look into, Anthony. And I know that I've had to call DEP and EP in because of, you know, odors and stuff like that from wood burning. Mechanisms, as I call them. And unfortunately, there will be more and more this year because of the high cost of heating as they predict. So maybe that's something we could do, Laurel. Anthony, maybe have one of our, I think you still have an intern. Who do we have from?
We've
No,
managed
we
to
lost them. They're gone.
we've managed to retain Caitlin.
Oh, you know what?
So,
You got to
Yeah.
get those student nurses. That's what we need again in there to do that as part of their projects, to
Yes.
do that and maybe put together. Catherine, that may be something that your youth action team might be interested in taking on as a little bit of a project, to write about that and write some type of an informational thing about where to go, who to call, what to do if you want to put in a wood burning stove. And maybe we can find out from the fire prevention what they have, and then put it together and give it out at town day at our table. That would be something.
And maybe Jen McDonald could help if we wanted to have something on our Health and Human Services website. I think you guys hit the nail on the head. Education, I think, is really our place in this. And I think a lot of folks just may not know what they can and cannot burn. And I appreciate you coming forward, Christine, and bringing this to our attention, because I think, like, I believe it was you, Laurel, or Lane said, we don't know until another citizen comes and mentions it, that something's going on. But I think having something at town day, or maybe even something, you know, like a small handout, like, these are the things to burn, these are the things not to burn. Don't forget to ventilate, stuff like that.
Less often.
Well, the timing might be really good for that, because I just looked up Fire Prevention Week is the 9th to the 15th of October.
Okay.
Maybe
So
we could
town day's
reach
the
out to
8th.
them.
Yes, exactly. Yeah. So maybe, I don't know, if Anthony, is Caitlin, is that something that maybe she could spend some time on, or?
yeah, so we're working. Catherine and I are working with Hayes from the Shared Service Grant to see if we can find some arrangement where Caitlin's able to help us with, you know, things like communications and some of this research. So definitely something possible. And, you know, if Caitlin's not the one to do it, we'll be able to find some resources to do it.
I bet the fire department has a ton of stuff that we could possibly make use of.
Partner with them a little bit and see
Yeah.
what they could give us and we could give. Thank you, Christine, for bringing this up, because I know that sometimes people don't like to say it. They feel like they're squealing on their neighbor, but how many times I think we can all admit that the local person is burning something in their fireplace, and then you can smell it. And I've done it myself, and go outside and say, what is that odor? Is that really a fireplace, or is that a fire? You know, and that's probably something that we can
and
do.
Christine's point is, I believe, and I know you have your hand up, so I leave it to the chair, but you know, that any wood burning, you know, I mean, this is not clean stuff. This is going backwards, but I think in New England, we think it's quaint. So I think I think that, you know, if we can find anything that just talks about air quality and density, you can certainly wrap this into climate change. But I don't, you know, what I'm trying to figure out, I'm trying to thread the needle on changing behavior, you know, with a soft and firm approach of education versus making another rule. And, you know, and the way things have gone in this town, I don't sense that we would ever, because we would have to, like, this would have to be a town ordinance. I don't believe the Board of Health can just sit there and say, you know, we're making a regulation. It would go all the way to town meeting. And so I just, you know, I'm just trying to, I'm playing the long game here, going, oh, well, you know, what, you know, that, you know, we may make some movement, but we'll make immediate movement you know, with education.
Christine, please go ahead.
Yeah, no, I'm sorry if I gave the impression I was asking you to come up with new regulations. I wasn't asking that. I was asking the regulations that are on the books, that are DEP's regulations regarding smoke and opacity.
Yeah.
Those are assumed to be enforced by the local boards of public.
That's true. Yeah.
So that was my question. How would you go about doing that? You know, I guess I would be very concerned if in some of the educational material, you had things that said, if you're considering putting a wood stove in, these are the ways to do it properly. That's encouraging people to take a path that, you know, I really think we should be discouraging people from putting in wood stoves. And I think there are many organizations at the national and state level that are on board with that, discouraging people at this stage from starting up wood burning as a new strategy. You know, it's not, so those are a couple points. And I definitely, you know, from living in Wakefield for 10 years, I have found there have been times when I personally have brought something forward to the town and it didn't, and if it regarded some practice that I thought was really egregious, it's very difficult to bring that forward about a neighbor.
Oh yeah.
Very, very difficult. And I was involved, you know, not to digress, but there were 25 trees cut down, you know, right near Crystal Lake. And I made a call to the DPW and the amount, and I didn't even know who it was. It turned out it was a neighbor. And it actually got brought to town meeting and he was fined several thousand, like close to $15,000 for doing that. But the blowback I got just from making a call to DPW, it could be very, very hard to do that. So it's hard to imagine when I open my door and have a face full of smoke from my neighbor that I'm going to call the fire department.
Right. I hear what you're saying.
Yet I feel like I'm having elevated heart rate. Is it because I know that that's not a healthy thing, or is it because the actual physiological effects of breathing that much smoke in? I mean, you know, so, but if I call the fire department, you know, it's going to be obvious somebody right close by called the fire department on their neighbor. And that's very, very awkward.
Right. Right. I think it's challenging. I think I appreciate that you're trying to come at this from more of like a global perspective, you know, that perhaps we should be thinking about, you know, rethinking what we are burning and considering finding alternative ways to heat our home in the future. You know, there may be a few residents who, you know, just burn wood out of habit rather than out of true preference. And maybe more education would sort of open their eyes to other options to heat their home. You know, I think I can appreciate you wanting to bring this up without being specific about where your concerns come from.
Anthony, can you check these DEP regs and try to get, well, on your list of things to do, but amongst health department directors, and Catherine as well, you know, can we just kind of get a sense, you know, we have lots of things on the books that are not enforced or are barely enforceable, but it would be nice to see if anyone has dared go there and just kind of learn some best practices while we're kind of ramping up an education campaign, because, you know, we may get to a point like, you know, I mean, Wakefield should be remembering how odd it was to be a mile away from a forest fire. You know, that is essentially the summer, you know, that's pretty similar to the winter impact of a lot of people burning at the same time.
It's
And
true, that's a good point, Laura, that, you know, we're right on the heels of that, and this may make it an even better time to sort of remind folks about safety.
well, and health concerns, and it's hard. New England keeps growing trees. It's right there. You got free fuel right there.
And I
It's
don't
really
think that,
irresistible.
yeah, a lot of people don't think about what they're doing when they go to burn things like that, Christine. I've seen it, you know, like people in fireplaces and they say, you know, how you shouldn't burn this, this, or that. And I had somebody say to me, oh, no, you can burn that. And I go, oh, no, you
Yeah,
can't. No, you can't.
yeah.
That's why I don't use my fireplace anymore.
Yeah, no, I think there's a
You know?
trend there, but it's,
Yeah.
you know,
And I
it's
think
very
that that's what
cultural.
it is. We sometimes don't realize, Christine, how close we are to each other. Do you know what I mean? So you don't realize that you may have your fireplace on and you might be burning something. But like you say, if you're out in the middle of the woods in Vermont or in Maine or New Hampshire, could be miles away. But here we're only like 100 and something feet maybe from somebody, and how we can see that and how it could really impact somebody very, very vulnerable to that type of smoke. And maybe they just don't realize it and remember. I just think that there's not much education about it. That's my opinion in dealing with it. People just don't know. Well, they say they don't know, but I don't know. I learned.
Well, I did ask my neighbor last year. I said, that's a lot of smoke and that is bothering me. And he said, well, we're just going to keep burning. We're not going to stop.
Yeah.
So I think
Yeah.
it'd be nice to think that we could just knock on our neighbors' doors. And this is a new stove. This wasn't something he's done. They just moved in 2 years ago and last year they installed it. So there's new installations taking place. So I think it's nice to think that you could knock on your neighbor's door and tell them something's bothering you and that they would take action on that. But that's not what I'm talking about.
No.
I'm sorry that that's not the case.
I gotcha.
So you're just talking for people to be more aware. You want people to be more aware of this burning and what it can do and what the effects are and what to do and what not to burn.
And what the regulations are.
What the regulations are.
And will somebody do something about that if there's an obvious violation of that?
Well, you know, so part of the education is pull those regs, get them in a way, you know, get them out there so people actually know, oh, there is a rule. It's not just an opinion or a preference. You know, I think that's where that's where you reference and you put some teeth in things. So we're going to, you know, more to follow. I hear you loud and clear. I think we need to do a little research on how best to move the needle on this.
But thank you again for reminding us how important it is.
Oh, thank you
for bringing it up. A lot of people don't want to bring it up, but I've heard the complaints before and had to go to DEP and them and deal with them to come out to help to put in regulations to, you know, make sure things were enforced and people were aware that it was not only us. I call them a higher echelon that you also have to answer to.
Yeah, exactly. Thank you very much.
Thank you.
Your time.
Thank you very much for joining us.
Yeah.
All right. Anthony, I think your health director's report may be the last thing on our agenda. Cindy, am I missing anything else? I think that's, yeah. Okay, cool.
It is the last thing, and everything on my report we've already gone through. The only thing that we didn't talk about was clinics. So I think we've already sent the information out.
We got the memo.
Yeah, we already got the clinics. I know, Laurel, it's your favorite time of year.
Oh, I have questions actually about those.
Yes,
Maybe you're going to get into it.
No, it's okay. Go ahead.
Can you lay out which clinics are going to include children and high dose flu?
Sure. Yeah. And Cindy, you have the calendar up, I think. So flu. Okay. So I just want to go over quickly before we go to flu. We have one COVID clinic, one joint COVID clinic this season. It is we have 300 doses available. It is the bivalent COVID booster. So we're going to be offering it at Memorial Hall. It's a joint clinic. We will be having Jen McDonald and our counterpart in Melrose help to blast this out as widely as possible. The Pfizer booster is 12 and over only for the booster, and we're not offering first or second shots. These are strictly booster clinic.
Yep.
So, you know, Melissa was on earlier. We are still looking for help. We are looking for administrators to help with color. We're also looking for 2 monitors to help us monitor folks after they get their shot. So if you know of anybody that might still be interested in volunteering, please feel free to let any of us know, or we can send directly to Melissa as well, and because she's taking care of that.
Is it still a
organization.
pain in the neck product to deal with the super frozen stuff and all of that?
Oh, if it wasn't, we wouldn't get paid as much. No, it's it is still
I
difficult.
aged 5 years that 2 weekends.
That's why I
Yes.
volunteered to do the booster clinic. I figured, what the heck?
You'll get your money's worth all in one
Elaine is
clinic.
our expert chemist.
Yes.
When is this one happening?
This one is
week,
happening
Thursday,
next Thursday at Memorial Hall from 3 to 7 p.m.
I got 4 to 7.
Is it 4 to 7? 3 to
Yeah,
7?
it's 4 to 7.
It's
That's
4
what
to
I
7.
have.
I can't even get there till 5. So
It's
I need
3 to 7.
Oh well, we
I think
This-
on the first one, she sent out 4 to 7, but I think she sent it again and changed it to 3 so they could get there early to get.
It's
the,
going out tonight. It got messaged to Jen this afternoon. Denise sent me the link and I forwarded it to Jen, so that should
And
be
we
going
have to-
out probably tomorrow.
So just an aside, we're getting a massive junk email in our Board of Health email. You know, when it used to be that we weren't supposed to erase any communications, but I'm dumping those. This is ridiculous. You know, it's just like, hey, you want to come to a, HR leadership? I'm like, where are these things coming from? You guys getting those?
Is that at your Wakefield email?
Yeah.
A
All
lot
of
from
you?
Evite. Yeah, I'm getting Evite and who's
It's
coat
happening.
manufacturers.
It's happening.
But I'm not
in-
getting my DPH for my weekly Maven. It will not come through. It will not come through no matter what they do. And
It's
that's
happen-
not right.
You know,
It's
when I
happening-
get junk, it's from Color. I get a bunch of junk from
A lot
Color.
of junk from Color.
I get
The-
everything from, it's not junk from Color. It's very informative, right, Cindy?
Help me. We
The-
have to, so if we're vaccinators, we have to re-up our Color situation.
And send that consent or that thing to Melissa with your license on it and everything.
Okay.
The Evite stuff you're talking about is happening in Melrose too. It's just that we have an email filter there that's catching all of it.
Not face. That's it. Not face. Constantly.
Oh, I'm not getting that.
No, and I don't get Evite either. I get somebody asking me to join some women's leaders group.
Oh, that one, yeah. They
Yeah.
do that all the time.
Okay.
yeah.
At first I was really flattered and then I was like, all right.
Yeah. Yeah, you want to be who's who also? There's
Yeah.
a-
Yeah.
Which,
No,
book-
thank
which year do you want to see the copy of?
Yeah. No, thank you.
Okay. So we have to do Color. I need to do that. And then, so that's all we're doing for COVID is that one.
Yes, that's the only one we're doing. We're going to have a staff clinic for Wakefield staff. We're going to have a few other clinics as well. One of them is going to take the place of the Marical Civic Center family clinic that we had last year. So essentially, it'll be open to kids as well.
Oh, okay.
Yeah, so we'll have the complete calendar. Cindy, we haven't sent that out yet, have we?
Not the complete. We're
No.
we're almost final with it, but just so you guys know, for Wakefield, our big clinic's gonna be on 10/8 this Saturday. I know, Laurel, you're not there, but we're gonna do farmers market 9 to 12 and then town day 1 to 4.
Yeah.
And that's 5+, and we will have high dose.
I'll be there in the afternoon that day.
Yeah, so I don't know.
Gotta
Did you
try.
got
I
the-
don't know which.
Yeah, you're both, I know you're both away. Did you get the volunteer list from Melissa? She sent that out, right? So
Yesterday, yeah.
whatever, I know some have responded, some didn't, but then the other big joint flu clinic will be in Wakefield at the Americal on November 5th, and same thing, 5+ and high dose as well. That hasn't been sent out yet.
So just as a side note, one more thing that we haven't mentioned. So last year we had success with this, and I'll reach out to Karen Burke this year, but the COA was instrumental in helping us set up a call center essentially before these clinics. Obviously pre-registration was, a huge help to us getting those lines moved up so quickly. So we'll work with them to publish this widely so that seniors and other folks that may not be able to, work the technology to get themselves signed up, they can do that over the phone. So that would be helpful.
I haven't looked at the Mass DPH site in forever. Are they still doing big time clinics run by the ambulance companies, or are those all kind of standing?
They are. There's one that I know of. It's very hard to reserve. If you know way ahead of time, and we might end up booking one of those, but the challenge always being, sometimes some, depending on the vendor, depending on who it is, some require more setup and handholding than others. So we want to make sure
Yeah, I'm
that
not talking about inviting them back. I'm talking about telling people where else they can go.
if they can, yes.
I don't want them. I don't want. I like our in-house team.
Oh, okay. That's good
Laurel
to hear.
likes to keep it in the family.
I like to keep it in the
Yes.
family.
It's very good because, yep, it's consistent and we know the residents and they know us and
Yes.
we're able to do a lot more educational things at
Yes.
those type of clinics.
Well, what
Much-
we want to bring back this year, which I mean, I think what happened last year, as you know, color, we all got on board just the end of August to start like a small training that they give you. And so we're all learning. So that's why I think a little panic settled in. Now Melissa's new, we're all learning new color. So we're like, oh, let's get some help here. But ultimately, I think we do a great, a better job, in my opinion. But I think we're also going to go back to the senior center clinic. So we'll have to reach out to Karen because we haven't done that one in a few years. We just try to reach.
We're gonna pull Karen Cronin back to volunteer to do some shots.
Karen Burke.
Karen Burke.
We can do the
She's the
senior
new.
center.
Oh, sorry, Laurel. She's the new Council on Aging director.
Oh yeah, no, I got that.
Oh.
I'm talking about our old nurse.
Well,
Yeah,
if
yeah.
Karen's not too busy with Linfield,
Busy
then,
running
she can-
clinics.
Yep.
Oh,
Yeah,
she's a-
she called
she's
me
over-
today
she's
about
over
the
at Linfield.
She is the public health nurse for the town of
Nurse for
Linfield.
Linfield.
I missed a moment.
Oh, God, Laurel. I see you missed me that I didn't get to Maine that day. And you missed all the little public health stuff. And I do apologize to the board. I know you're gonna think I'm mean, but I will not be there at the big clinic in the 5th because that is the opening of the American Public Health Association's National
Oh,
Convention.
you're such a nerd. Wow.
And I'm on the committee for the nursing, and I will be, unfortunately, I will be at the Seaport
Sounds
from
like a
then
higher
until the
calling.
following Wednesday.
Higher
Yeah,
calling.
constantly. And I hope to see maybe Anthony there. Don't forget.
I did not forget. We are
Better
working on
not,
registration.
You better register. And I wish that Candace and Laurel could come too. It's a great event. It's the first one we've had in
All
2
weekend
years.
long.
It's from Saturday till Wednesday, and it's
Wow.
24/7. I'll be every day.
Still using all my
Tending.
brain space for meds.
The last time I was there, I was presenting.
Oh, well, there you go. Maybe I could have you present this year. You didn't put in anything. That's what I'm doing tomorrow is reviewing.
1
I'm
year
on
in the
that
life of
committee.
the health director.
Yeah, I'm
Yeah,
reviewing
happy
that
1 year
also.
anniversary, Anthony. Well done.
Thank you, Laurel.
And
It's,
happy birthday. We forgot his birthday this year again.
Oh, thank you.
Yeah, I remembered.
Oh, Lane, thank you.
Cindy
Yeah.
actually had to remind me, and I said, "Oh my God, that's right."
It's been a year and it's been fun with all of you. You guys are great.
It's
Gone fast.
Just
Good
think,
times, good times.
19 more and you can retire.
Or not, take it from Elaine.
Next
Well,
next month, can we throw Lake Quinnipiac testing history on the agenda? I think Erin's doing some work on it, and she was throwing around.
Yes. So
Yeah.
I'm glad you brought that up, Laurel. That's one of the things that we want. It was a little bit late to bring on for this one, but we do
We've
want to.
gone over 2 hours. This is a new
Yeah,
record. So
yes.
fine.
We do want to talk about Lake Q next time, so we'll put that on the agenda. We've also got a couple other cases that we're just gathering more details on right now, so we didn't think it was appropriate to bring it up now, but we'll have more details for the board next time. Just a couple of other cases. So yeah,
Is that it for your report, Anthony?
that's all I had.
19 October,
Yes.
third
Yep.
third Wednesday.
My calendar put the Wednesday on the other side. Okay. 6 p.m.
Yep.
We
All right.
get to talk about all the cool things that Wake Up is doing next time.
Okay.
And there's and also Wave has a run on October 1st, so it's always.
Oh,
good to
yeah, yep.
Help each other out. There's just too few of us to like, be showing up at these occasions to represent the board. It's like, you got us for clinics. That's our niche.
I did the run like a couple years ago when we
Oh,
all
of
had to
course you
sort of
did.
like take our picture and like put it
I
up
did the
there.
stroll. I crawled. All right.
Anything
All right.
else? Any final thoughts?
Nope, that's it. Thank you, everyone.
Good to
Take a
see
motion
everybody.
to maybe adjourn, anyone?
Make a motion to adjourn at
And
8:14.
I will second that motion.
All in favor?
Oh, so I.
All right.
Very much, aye, so moved. Thank you, everybody.
Nighty night. Take good
Thank you.
care. Got
Good
to
night.
Thank you.
to the end. All right. Bye.